Hello everyone, I'm Dr. Divya Madan. Welcome back to my YouTube channel. As you must have already seen that NMC has dropped a bomb again about the next examination. In the curriculum of 2021 MBBS batchmates, there was given that they will have to give a next exam, an entrance test, an exit exam, right? And that exam would serve for their as a license exam, as an exam for going through internship, and as an exam to procure your license, right? So similar to MLE and reading the guidelines, I felt that it is quite similar to MLE exam. First of all, I'm quite busy right now. I'm in my third year of residency, stuck in the thesis work and studies. But one of my cousin who is actually doing MBBS in Gujarat, he called up and asked as to what is the buzz about it, and he was low key panicking about the situation. So I read through these guidelines, and I thought it would be good to share my views on it and ask for the comments, because the government NMC is actually asking for the comments and suggestions as to how to improve and on these suggested guidelines. So let's have a look what all they have proposed right now. So first of all, this exit exam, as I already mentioned, would serve as your licensing exam. That is, it will give you your prefix, doctor, before your name. It will also give you a provisional degree, right? Also, the marks of this exam will give you a seat, the postgraduate seat. And it is a licensing exam, so any foreign medical graduate who is planning to practice in India will also have to give this exam. It's going to be 2 steps. Next will be in step 1 and step 2. Step 1 would actually be replace your theory exam, right? It will have 6 subjects like medicine, obs-gynae, surgery, and all the applied aspects of it, pediatrics. Along with it, ENT and opthal would be there, and also the clinical aspects of first and second year, right? So essentially, if you look at it, that they're asking all the clinical facts, right? So this exam is going to be more clinical oriented, like MLE. If you came across any of the books like Case Files or U World, if you have practiced some of the questions, and even First Aid, you have seen that most of the questions, they are linked somehow to a clinical situation, and that makes it more interesting and as to why we need this information, right? There's one thing, a rote learning, that where you ratify the facts and they ask one line in the exam, and the other thing is asking the clinical aspect of it, which I believe is a good way to assess all your understanding. So I believe next exam is an upgrade to NEET, because you don't have to cram the most common causes or the percentages or the half-life of letrozole or anything else. It would be purely clinically oriented, right? The applied of your knowledge. So it will definitely change the way your MBBS students read their basic books, right? And I think that would also make them fall in love with the subject of medicine, because reading clinically, having a correlation, always makes you more excited, right? Whenever you apply a knowledge to a certain scenario, you feel better about yourself, I believe so. So I think this next exam pattern is definitely better, but the loophole here is most of our apps and the conventional coaching is designed as such, because in the previous year the pattern has been shifting, but it is not purely clinical. You still have some factual questions. So with the next in mind, now you have to deal with the clinics only, like a clinical exam pattern only. So I was just discussing this with one of my friends, and he happens to be connected with the Prepladder, and when I asked if they are planning to go to the clinical based switch to clinical based questionnaire and everything, they were like they are actually planning since 1 year to shift that. So I was really very excited to have a look at the question bank, because at my time I went through some of the U-World questions just out of the curiosity that how Emily people ask their questions, because I was always intrigued by the first aid even before it was that famous. So I had demo access to these questions, and I thought I should share it with you as well, because it will give you an idea as to how you will have to prepare for the next exam. Without further ado, I think I should just get through how you can go through the clinical questions and how you should be now oriented towards your studies. And for that, I'm taking the help of the questions that I had access to, simply because I don't have my case files book right now, and neither do I have UWorld access. The only thing I had access to was the Prepladder ones. So let's go through some of the questions, and and have a brief idea as to how you will now approach your studies. And in the last, there is integrated essentials, that is system wise learning for the next pattern, which is really amazing, I feel, because none of the coaching apps right now have that pure clinical Qbank. And if they are planning to release something like that, it will be the UWorld for your Indian coaching, the next exam. So let's have some questions. They have divided it system wise, like the reproductive system, GI system, which would be from complete physiology, anatomy part, right? They have divided it in such a way that it's so beautiful. If you have read first aid or any other given questions of case files and everything, even if you have read Harrison, then they have given physiology, pathology, that pattern, right? So if you go through neurology, then they will start with the anatomy, then the physiology part of it, then the pathology part of it, then pharmacology part of it, then the medicine aspect of it, the pediatric neurology, radiology, which is really amazing. So let's have a look at the neurology questions, because I like neurology. So let's go with anatomy, because neuroanatomy is a high yield topic. Let's see how they correlate neuroanatomy with the clinical questions. I'll have just a single question. We'll practice just one single question, for example. So the question is, while during surgery for meningioma, the left paracentral lobule got injured, and that will lead to the paralysis of. So it is again a clinical integration question. We all know the homunculus pattern, right? So they are saying left paracentral lobule. So left and paracentral, that means around the center. So that would be, if you remember the homunculus, it would be right. So I got the right question here, but the importance of this, as I've already discussed in the previous question as well, whenever you are solving a question, try to rule out also what other options are incorrect, right? I knew this is the correct option, but I should also know why left face was incorrect, why right neck and scapular region was incorrect, why right shoulder and trunk would incorrect, right? So the learning objective here is the cerebral homunculus. The explanation is really good, I believe, because they have given a learning objective, right? Homunculus picture is given, and also the neuroanatomy part of it. And also they have given what other areas would affect the other. Like the first question was face area, right? So face area would be involved if lower and lateral part would be involved, where there is the homunculus, right? Pelvis and perineum will be a slightly higher area, and upper limb would also be the higher areas. Thumb would also be lateral, and the hands would also be in the lateral part. So this way the anatomy is connected to the clinical part, right? The patient had a meningioma surgery, and the left paracentral lobe was excised or injured. So the paralysis of which region would be there? So it is really amazing how everything is correlated, right? A surgical anatomy question to a clinical pattern, right? So this way the exam is going to be really amazing. I feel really excited that some better step is going to happen, and It's really amazing that NMC has asked for comments on their proposed draft, which is like democracy pro max. You can have your queries there, you can give out your suggestions, and at the end of the day they are just telling you to study since day one. Enjoy the field of medicine, enjoy the love of medicine, and don't just cram up things. Correlate them clinically. Be it next, be it NEET PG, you have to have a strong hold of your subject and read it in some way, that because read it in such a way that you know that it will give you a good rank as well as help you in managing your patients. So next I think is a great improvement, because it will be a uniform exam all over the India, and also it is clinically oriented, right? You don't have to write the theory paper, it will be a multiple choice questions again. And the pattern they have also given. After you clear this next one, they will have next two, that would be after the internship. So I won't go any further. I will just post the link in the description box as to what is the pattern, how the exam will be covered. If you don't passes in any of the exam more than 50%, then you have to give supplementary exam. That would be once a year. So one final exam and one supplementary exam, and you can also improve your marks if you feel like you are not getting the PG seat of your choice. But the weird point here was that they will not calculate that particular year's score. They will average down the scores of the last 3 consecutive years. So if this year your exam is really bad and the next year you perform exceedingly well, but your average would be down, right? So it is a really heads up to all those MBBS students to start studying from the start only, and don't wait that I'll go through internship and then give another attempt, because it will be very tiresome to give the exam and again, and also the average thing is really weird, right? So your last attempt can affect actually your this attempt. There is no plain sheet, right? All those who are interested, Prepladder is going to launch their next Qbank edition in January February 23, and you can just have trial access for 10 days to this Qbank by clicking on the link in the description box below. You will get the access for 10 days as soon as the Qbank edition is ready. Thank you and have a nice day.